Yeah, it's interesting compared to the other congresses, cardiology congresses in the United States. The practice of heart failure and cardiology here is different, and I learn a lot from being here in the sense that there is some overlap between intensive care medicine and cardiovascular care units and then the general cardiology wards. So the practices patterns are much different, and it takes some getting used to. During the lecture sessions, listening to people talk about how patients flow from sort of the emergency room into the hospital and into the ICU. Those patterns are different than what goes on in the United States. So it was interesting to hear everybody talk, and I finally think I understand the patterns a little bit. But then at dinner last night, then it varies from, you go from Romania to Greece, to just, you know, a couple hundred miles away. The patterns in Hungary are different than Romania and Germany, and so that's the hardest part about talking to people about what emergency medicine is. My concept in my head of what emergency medicine is not what people think of the ER or the emergency room here. So it's been a nice, interesting learning experience. It's important. I don't know the impact of it in Europe or Romania, but it's a very important concept in the United States, especially that women have very atypical presentations for cardiovascular disease, and so sometimes the workup in women with chest pain or shortness of breath has to be a little bit more extensive because they can get missed a little bit easier than men can. So it's important that we put those ideas at the forefront so that we don't think everybody presents the same way. I would assume that has a lot to do with the workup of women and females in Romania and Europe as well. I think we've done a fairly good job in the last 10 years getting better at diagnosing heart failure, somewhat better at treatment. I think the biggest unmet need in our practice in the emergency medicine in heart failure is trying to be able to identify patients who are low risk enough to be able to go home from the emergency room and get an early follow-up with their doctor, hopefully their heart failure cardiologist, and prevent them from having to spend days in the hospital. But most importantly, if they do go home, making sure they don't come back and revisit the emergency room or hospital, which would have been an indicator that they should have been admitted in the first place. So I think that's the most exciting area in our field, is getting a better idea just who those patients are that can come in and be stabilized in the emergency room and safely go home and enjoy their life outside the hospital. I think the importance about this specialty in general, or heart failure in general, is that we have to work together, whether it's for research or patient care. It's very important that the first few hours of care in the emergency room transitions nicely and is incorporated into what the cardiologists in Romania or in the United States, for that matter, do. They have to work as a team. I think when we try to work individually, the patient, it's not smooth for the patient, it's not smooth for the physician to get them in and out of the hospital or in and out of the emergency room efficiently. So my message would be communicate and collaborate.